The Thomas test is commonly used by clinicians to assess range of motion at the hip joint. The Thomas test was created to test for hip flexion contracture. This test looks at 1 and 2 joint hip flexor tightness, focusing on the iliopsoas, the rectus femoris, the TFL, and sartorius. Alternate versions of the Thomas test include the modified Thomas test and the ground Thomas test. Both are detailed in your assessment manual. The testing procedure for the Thomas test. You will require the following equipment: a flat elevated surface with enough room for the client's legs to hang over the end, e.g. a screening bench or the boxes that you see in this video. You'll also need a towel, which the client should have, in which you will use for modesty if required. The test protocol. You'll demonstrate the assumed position that the client will be in to perform the test. Once you have demonstrated this position, you will then assist the client to perform the test. To do this, you will ask the client to sit on the end or the edge of the table in which half their thigh is able to sit off the bench. Ask the client to place their towel across their hips and allow it to sit in between their legs in case modesty is required. Place one hand behind the client's back and one hand behind the client's knee. Flex the knee towards the chest, and as the client lies back towards the surface, assist them to fall into a comfortable position. The client then holds the thigh, pulling the knee towards the chest only enough to flatten the back and sacrum towards the surface. Do not allow the client to over-pull their knee so that they increase the movement in their lumbar pelvic positioning. So make sure this remains flat throughout the duration of the test. Observe the lower limb positioning. To do this, allow the right knee, if the right knee is flexed towards the chest, the left thigh is allowed to drop towards the table, with the left knee flexed over the end of the bench. With 4 muscles involved at the end of this length test, variations may occur that require interpretation. Any variation from normal, as described in your assessment manual, is considered a positive for this test. Ensure to observe the client from the side, observing any hip and knee drop to observe for tightness. From above, observing any internal or external rotation of the femur, as well as in front, observing any medial or lateral translation. Your lab manual details any common positive test positions.